A Day in the Life of a Doctor by Heather Adamson. How do doctors begin their days? Some doctors work shifts in hospitals. Some doctors also work in clinics. Dr. Davis starts her day at the hospital. She wears a white coat and a stethoscope around her neck. She will visit patients at the hospital. Later, she will go to work at the clinic. Fun fact: doctors sometimes work 80 hours a week or more. What are rounds? Doctors make rounds to check on their patients who are in the hospital. Dr. Davis checks on a woman who had a baby. Dr. Davis also visits a patient who had surgery yesterday. She reads charts to see how the patient is doing. She writes orders for the nurses to follow. How do doctors help people? Doctors examine patients to make a diagnosis. Dr. Davis uses a scope to look in a patient's ear. She finds out why he is not feeling well. Dr. Davis writes a prescription for medicine to fight an infection and stop pain. Fun fact: doctors in the United States write at least 1.5 billion prescriptions for medicine each year. Why do healthy people go to the doctor? Healthy people need checkups to help them stay well. Dr. Davis looks in the patient's throat. She listens to her heart and lungs. She checks reflexes with a soft hammer. The patient will get a shot to prevent disease and keep her healthy. Who helps doctors? Many people help doctors. Nurses work with patients. Office workers make appointments and keep track of charts. Pharmacists also help doctors. They fill doctors' prescriptions. They get medicine ready for patients. Pharmacists explain what the medicine is for and how to take it. How do doctors learn patient care? Doctors go to school for many years to learn how to help patients. Doctors must keep learning. Dr. Davis goes to a meeting after lunch. She learns about new kinds of medicine. Fun: what happens if there is an emergency? Doctors work quickly in emergencies. Dr. Davis looks at an X-ray for one patient. Dr. Davis helps another patient who has a broken bone. She uses a cast to hold the bone in place. Some doctors also help with emergencies at night and on weekends. What happens at the end of a doctor's day? Doctors read over reports at the end of the day. Dr. Davis explains each patient's visit into a voice recorder. Her information will be added to the patient's chart. Dr. Davis helps many people every day.
Awesome. Okay, guys, so now we are going to test on a day in the life of a doctor. So, question number 1 says, what are doctors doing when they make rounds? A. Writing prescriptions for medicine. B. Checking on patients who are in the hospital. C. Making notes on their patients' charts. Or D. Reviewing their schedule of appointments for the day. Can anybody tell me what the answer is? Yes, B. Checking on patients who are in the hospital. Number 2. Dr. Davis uses a scope to A. Test a patient's reflex. B. Look inside a patient's ear. C. Put stitches in a patient's skin. Or D. Take a sample of a patient's blood. Does anybody know the answer? Letter B. Yes. Dr. Davis uses a scope to look inside a patient's ear. Number 3. What is part of a pharmacist's job? A. To get medicine ready for patients. B. To give shots to patients. C. To keep the hospital clean and free of germs. Or D. To read X-rays. Yes, letter A. One of the pharmacist's jobs is to get medicine ready for patients, guys. Number 4. At her meeting after lunch, Dr. Davis A. Learned about new medicines. B. Answered questions about her patients. C. Greeted the new doctors at the hospital. Or D. Helped make rules for the hospital. Anybody know the answer? Letter A. Number 5. What did Dr. Davis do at the end of the day? A. She explained each patient's visit into a voice recorder. B. She developed the x-rays she had taken that day. C. She went back to the hospital to make more rounds. Or D. She made sure that supplies closet had enough medicine for the next day. The answer is A, guys. She explained each patient's visit into a voice recorder. How much did you all like the book? 1 star, 2 star, 3 star, or 4? I think 4 stars. I think it was a really good story. And we got 100. Great job, guys. Keep up the good work.